Nasal sampling is less invasive and results in less patient discomfort than sampling from other upper respiratory anatomical sites. A self-administered nasal swab is similar to a nasopharyngeal swab in detecting coronavirus. Collection of nasal swab specimens is less technically complex and so can reduce the risk of the spread of infection to healthcare providers by 1. Reducing the duration of the procedure, and 2. Allowing the patient to perform self-collection while under supervision. It also lessens PPE utilization, given that the patient can perform self-collection under supervision versus the healthcare provider performing the collection. Prepare the room before the patient enters. Place all necessary equipment on a tray next to the examination table. Place an empty tray on the opposite side of the table. For nasal swabs, flocked swabs are preferred, but sterile Dacron and rayon swabs with plastic or flexible metal handles are also acceptable. Cotton or calcium alginate swabs or swabs with wooden sticks are not recommended. In addition to nasal swabs, you will need personal protective equipment or PPE. The type of PPE depends on who is collecting the specimen. If the patient is collecting his or her own specimen, and the healthcare provider stands at least 6 feet from the patient during specimen collection, then the healthcare provider should wear a laboratory coat or gown, a face mask or cloth face covering, gloves, and eye protection, either a face shield or goggles. Remember that all healthcare providers are advised to wear a form of universal source control, either a face mask or cloth face covering, at all times while in the healthcare facility. If the healthcare provider is collecting the specimen or will be within 6 feet of the patient, then the provider should wear an N95 or higher level respirator or face mask if a respirator is not available, eye protection, gloves, and a gown. Make sure that all sample tubes have been labeled and that the appropriate requisition forms have been filled out before starting the procedure. It is essential that you follow the pertinent standard and transmission-based precautions specified by the Centers for Disease Control and Prevention and by your own institution, and that you don the PPE correctly. If possible, you should put on and take off the PPE in the presence of an observer to make sure that there are no breaks in technique that may pose a risk of contamination. If the patient is collecting the specimen and the provider will be at least 6 feet away, first put on a lab coat or gown, wash your hands with soap and water, or use an alcohol-based hand rub, and don a pair of non-sterile gloves. Then put on a procedural mask. You do not need an N95 respirator if the patient is taking the sample, and you will be at least 6 feet away. Finally, put on a face shield or goggles. If the provider is collecting the specimen, or will be within 6 feet while the patient collects the specimen, first put on the gown. Wash your hands with soap and water, or use an alcohol-based hand rub, and put on a pair of non-sterile gloves. Then put on the N95 respirator or face mask if a respirator is not available. Finally, put on a face shield or goggles for eye protection. Masks are recommended for all patients suspected of having COVID-19. Ask the patient to wash his or her hands or use an alcohol-based hand rub before taking off the mask. The patient should be careful to avoid touching the front of the mask or the inside of the mask when removing it. The mask should be removed by unhooking the loops around the ears. To avoid contaminating the environment, the mask should be placed on the empty tray. Next, have the patient blow his or her nose into a tissue to clear excess secretions from the nasal passages. Instruct the patient to remove the swab from the packaging. Ask the patient to insert the swab at least ½ an inch inside the nostril. In other words, the entire tip of the swab should be inside the nostril. Firmly sample the nasal membrane by rotating the swab and leaving in place for 10 to 15 seconds. This should be repeated with the second nostril using the same swab. If the patient is unable to self-collect or has an issue with collecting the specimen, the healthcare professional should don the appropriate PPE, N95 respirator or higher level respirator or face mask if a respirator is not available, gloves, gown, and face shield or goggles, and use the same instructions for collecting the specimen. While the patient is holding the swab, instruct the patient to open the collection tube and insert the swab into the tube. Break the swab at the groove and discard what remains of the swab onto the table where the mask is. Close the labeled collection tube. Wipe the tube with a surface disinfectant wipe and insert the tube into an open biohazard bag. Ask the patient to perform hand hygiene using an alcohol-based hand rub or soap and water, and reapply their mask, again being careful not to touch the front or the inside of the mask. Depending on institutional practices, you may instead return the sample to its original packaging for transport. Follow the lab's directions for direct processing of the swab specimen or placement of the swab in media with or without refrigeration. Remove your PPE as described here, or in accordance with the standards at your institution. First, remove and discard your gloves, ensuring glove removal does not cause additional contamination of hands. Then remove the gown. When removing the gown, do so in a gentle manner, avoiding a forceful movement. Reach up to the shoulders and carefully pull down and away from the body. Rolling the gown down is an acceptable approach. Dispose in a trash receptacle. Facilities implementing reuse or extended use of PPE will need to adjust their donning and doffing procedures to accommodate those practices. You may now exit the patient room. Clean your hands with an alcohol-based solution or soap and water. Carefully remove your face shield or goggles by grabbing the strap and pulling upwards and away from the head. Do not touch the front of the face shield or goggles. You can dispose of it or clean and store it in accordance with the guidelines at your institution. If keeping the face mask on for universal control, then the same face mask can be kept on as long as it is not damp or soiled. Note, if removing the face mask for some reason, then remove and discard the face mask without touching the front of it. Carefully untie or unhook from the ears and pull away from the face without touching the front. Finally, clean your hands again with alcohol-based solution or soap and water after removing the face mask. The room should be cleaned and disinfected following routine procedures and using EPA-registered disinfectant and using standard precaution-appropriate PPE. Inform the patient that you will be contacting them when you receive the results from the lab